The other big reason is, as many of you have heard, there are these new mutant strains of the virus floating around. We know that the vaccine that we have now from Pfizer and Moderna probably works against the new strains. The new strains are not more dangerous, they're just profoundly more infectious. I mean, you think of how quickly this virus is spreading now. Imagine taking that and multiplying it by 50 or 70%. So a real good reason for getting the vaccine and getting it now, not tomorrow, not the next day, is that it's getting more dangerous out there because this new virus variant is spreading. So the vaccines that we have now that you're eligible to get are effective as of today, as far as we know. So what can you expect when you get the vaccine? So on the bottom is me, okay, getting it at the VA hospital in Washington, D.C. I would have been number one on the list if I could have, but I couldn't. On your right is probably, yeah, I think it's your right. That's our director of cardiothoracic surgery. And on the left is one of the 100 staff that I work with getting it. This is exactly what you can expect, okay? And I don't know for those of you who can see, but that was my second Band-Aid for my second dose. I wanted a lollipop and a smiley face, but they wouldn't give it to me. You will feel a small pinch from the needle, just like with any other, injection, okay? Your arm will probably feel a little bit sore. Usually the next day, you get a little soreness in the arm. They will watch you after you get the vaccine injection for 15 minutes. That's because we do that because we know if you're going to have a bad allergic reaction, and again, remember, only 11 people in a million have a serious allergic reaction. If it's going to happen, it's going to happen then. So they watch you for 15 minutes and they have everything there to treat you. Anybody who's had an allergic reaction from the vaccine, the rare people that have, they've all been treated, basically gone home. And then they'll give you an appointment for your next dose. That's that's exactly what you can expect. Now, some people, and it's usually people that are kind of, I'll say younger, but it's really kind of younger and healthier. So with, a 30-year-old direct support professional, 40-year-old direct support professional, a young teacher, you have very healthy immune responses. So it is normal, and it's actually a good thing. Some of those people will get, the next day will get chills, a little bit of muscle aches, a low-grade fever, some headaches, some tiredness, just kind of like you feel like you have kind of like the cold, bad cold. That lasts for 24 hours and then it goes away. That's actually a good sign. What that means is that your body it's working. Your body's producing antibodies and building up what it needs to. That's a little more common after the second dose of the vaccine than the first. And in many people, it doesn't happen. The majority of people probably do not get this, but some people do, and that's totally fine if they do. So one of the big things that we really need to be aware of is we were able to create this vaccine, which is huge, but it only works if people get it. And in order for all of us to be safe, for kids to go back to school, for parents to hug their children, for direct support professionals to finally eventually be able to take off all the gear they're wearing, we have to get people to take the vaccine. So part of my, passion in doing this is to try to give everybody the education they can to feel comfortable getting it. A lot of the polls that have been done, each one of these different colors is kind of a poll that has been done, and many of them, almost all of them, they show that up to half the population has very strong concerns about taking it because they're just afraid. And if you break it down further, there's a much stronger level of concern and initial unwillingness to take it amongst, and I've only put in kind of a couple of what we would say, if you want to use the word minority groups or whatever term you want to use, but up to 20, up to a large, whatever minority group you want to look at, very significant percentages will not get it. Okay, so they're concerned. So a lot of this is education and trying to give people the information they need to go ahead and feel comfortable getting the vaccine. Um,
Dr. Greenberg, do you want to go ahead and answer a couple questions?
yep.
Okay. Okay. What if you've already had COVID? Should you get the vaccine?
Yes, if you've had COVID, get the vaccine. Having COVID protects you probably for about 90 days. After that, we don't know. So the CDC recommends that if you've had COVID, but it's been 90 days or more, you want to get it.
Perfect. Thank you. Another question. Will a person who gets vaccinated always have a positive COVID result?
Um, it, I have to kind of, it depends what you mean by positive COVID result. So when you get a COVID test, there are two types of tests. One is where they would swab your nose and look to see if they see the virus in there. The answer is no, not necessarily at all. The other is where they test and see if you made antibodies. So your body would show that it's protected. So, but you would, when we say a positive COVID test, like if you think about going and getting tested for COVID, the answer is no, you would not always have a positive COVID test.
Thank you. A couple more. What does post COVID or long COVID mean?
Post COVID or long COVID is kind of a very generic term. It's not so much a scientific term, but what it may be referring to is there are people who, there are two ways it can be used. There are people that have COVID, the illness, that then have problems down months after. So we think of COVID as kind of, you get sick, you go into the hospital, and many people die. But there are people that get sick, may not go into the hospital, or go into the hospital, make it out, but then for weeks, months, maybe even years, have other types of problems, heart problems, all sorts of delayed problems from the COVID virus. So that's another reason to also get the vaccine. It doesn't just prevent you from getting sick in the way we think about, oh, my friend got COVID and he was hospitalized. I see them at the hospital all the time. I'm a cardiologist. We have dozens of patients who had COVID, maybe not even really bad, but then, months later, they have problems with their heart. So that may be what long COVID is being referred to.
Thank you. We're going to answer a few more because a bunch came in at once. There has been some information going around that there are pork products in at least one of the vaccines. Can you touch on this? I know that some flu shot manufacturers use egg products. Is this sort of the same thing?
So to the best of my knowledge, that is not, there is no issue with any of the approved vaccines. I'm not talking about unapproved, but the Pfizer and Moderna, there are no issues. There was media coverage several months ago that kind of hyped certain things, and it wasn't a problem with the virus. It wasn't a problem with the vaccine ingredients. It was a problem with the logistics of the way stuff was being the supplies are not getting the factories, but there is no problem with any of the ingredients that I'm aware of at all. Doesn't mean there's not a news story, but there's absolutely no problem.
Thank you. Another question. Can you get the vaccine immediately after recovery from COVID?
So good question. The general answer is because there's a limited supply of vaccine, and because we do think that having COVID protects you for several months, the CDC generally recommends, and most vaccine centers won't give it to you if you've just had COVID. They'll give it to you 3 months after.
Thank you. Dr. Greenberg, there's a couple more, but if you want to continue on with your
Okay. Sure, and then we can add them in.
yeah,
So,
presentation.
so really important is, and this came up before, the vaccine prevents you from getting sick. It does not prevent other people. So to make it real, if you're a direct support professional and you work in a residence or you work in a day program, for now, you still need to wear your face shield because you're not going to get sick, but you could have the virus floating around in you, not even know it, and give it to someone else. So you still have to take precautions, but the precautions are a little bit more to keep other people safe. So I just want to kind of make sure people understand that difference. Um, okay, I want to go into now what vaccines are there, what's out there. So we're going to focus on there are two FDA approved vaccines, the Pfizer and the Moderna. There are a whole bunch of other ones, but the only ones I'm talking about are the ones that are right now approved. The AstraZeneca will probably be approved shortly. It's being used in England. The Pfizer and Moderna vaccine were approved in early December, December 11th, December 18th. They're both effectively the same type of vaccine. From a person getting it, doesn't matter which of these two you get. Whatever I say about one completely applies to the other. That's not true with some of the other vaccines coming out, but these two are the same. The only difference is the Pfizer needs to be kept stored really cold. But in terms of how they work and everything else, side effects, they're identical. I want to give you the information so you can understand firsthand, not just say it's safe. The Pfizer vaccine, which is the one that first came out, is what's called a messenger RNA vaccine. If you take away the science, what it means is there's no living virus, there's no dead virus in it. They looked at it in 40,000 people who they studied intensely. Those people were all over the age of 16, which is why we don't give the vaccine to younger people, because we haven't proven yet it's safe. We're studying that, but you get 2 doses of the vaccine, 1 dose on day 1, and the other one is about 3 weeks later. So it's separated by 3 weeks. And again, to the question before, it gives your body a chance to really build up antibodies to protect itself. It's 95% effective in the studies, okay? Which means that in 95 of 100 people that get it, it works. That is huge. If you compare that to other vaccines like the influenza vaccine, we struggle with, 70%, 60%. We were hoping when this was first developed, we would have been happy with 70%. It's actually 95%. And that is really, really a very effective vaccine. So one of the questions is, were people like me in the study? Okay, I mean, who was studied? So in the Pfizer vaccine studies, there were about 43,000 individuals. They very wide age range, from 16 up to 91. They used about 150 plus different sites or places they studied throughout the world, not just something done in one part of the United States. There was a pretty even distribution between men and women, which is good. For many, many years, I mean, I've been doing this and been doing research and clinical studies for many years. And especially like 20 years ago, these studies would be like 90% men, and you'd be lucky if you had 10% women. So importantly, it was studied in both genders. There was, wouldn't say I'd like to see more, but there was representation in, Blacks, Hispanics, Asians, whites, and others. Part of the limitations here is the ability to recruit people. If people are more nervous, they're not going to get it. But there was reasonable, representation. So it was used in many kind of different types of individuals. Let me just quickly touch on the Moderna vaccine, because you may get either one. So I want you to just understand that they're really the same thing. Pretty much everything here is the same. This one, they looked at people 18 and older, not 16, but that's a very minor difference. It's also 2 doses. The only difference here is you get on day 1, and the other one is 4 weeks apart, whereas the Pfizer was 3 weeks. The same effectiveness, 94%. So again, incredibly effective. All right, let me stop and take a couple of questions. Anybody?
Okay, let me see. Can I still donate blood after I get the vaccine?
That's a good question, and I don't know the answer to that. My guess would be yes, but I don't want to kind of give out wrong. So I don't know the answer to that.
Thank you. How long does the vaccine protect you?
Excellent question. we don't know right now at this point. Um, so I want to be careful. I only want to kind of give information about things we know for sure. So we know it works for, 3, 4 months, 5 months. It may work for a year or 2 years. We just don't know because we haven't been able to follow that many people. So the best thing we can say is it works for 3, 4, 5 months. We will have a better idea over the next year or so because we will be able to see all those people we gave it to. So I think the real answer is we don't know, but we're sure it's more than 3 months and probably significantly longer.
Okay, another question. Is there any way to really determine if you already had it? If antibodies are only present for 90 days, I won't ever be able to tell if I had it last winter before COVID was a thing. I was sick for 3 months and my lungs are not the same.
Yeah, that's a kind of an individual question. So it's a little hard for me to answer that. I'm going to kind of buck that because there's just too many specific things I need to kind of know. There are people, if you had COVID in general 6 months ago, you may not be able to test for it now and really know for sure what was back then. So that would be a general answer.
Got it. Thank you. One more question, or I think a couple more questions. Given that it is a new vaccine, what are the concerns for any long term risk of the vaccine? Are there any?
Sure, that's a really good question. So the answer is, we only know for the amount of time we've been using it, 3, 4, 5 months, 6 months, 7 months for depending on, we're talking about the studies. So in terms of long-term effects, we don't have that information. Um, we know from almost every other vaccine out there that the problems people get with vaccines tend to be now. They're not things that occur years later. That's just not what we see in any of the other vaccines, whether it's a polio vaccine or a measles vaccine or or it's whatever vaccine you want to choose. So we don't have any reason to suspect that this would be any different. Um, I know there are very strong opinions, and people have, there's a lot of, you know, strong coverage and concern with actually vaccines and stuff causing autism, and to put it simply, and everybody has opinions about that. But from a scientific standpoint, that information and the stuff that was published around that was fraudulent, and it was retracted by the people that did it. So I don't want to kind of focus on that, but that would be a natural question somebody might raise. But there's no evidence we have at all, and nothing with any other vaccines.
Thank you. One more question. Is natural immunity better than acquired immunity?
Yeah, I think that's a hard question to answer. I don't think we could really say, having studied it, I don't think there's any real difference. If you're immune to it, you're immune to it, and you're being immune means you're not going to get sick a second time. The only way to have natural immunity would be to get COVID. So I don't think anybody, the risk getting COVID to get immune wouldn't, I don't think there's a difference. I think when you're immune, you're immune.
Okay, I'm going to ask one more question, then you can go back to your presentation. Once I get the vaccine, will it be necessary to get tested for COVID?
So in the short term, the answer is yes, because remember, you're getting tested for COVID probably not to see if you have it necessarily, but because in organizations and so forth, we have to make sure it's safe for you to work with other people, and that you're not going to give it to someone. So the answer is, in the short term, you'll probably still need surveillance testing within organizations and groups. And the other thing is, it's 95% effective. That's not 100%. So people need to, it's not like a magic bullet, like, okay, now I can go out and party, do whatever I want. There are people that can get it. 95% is not 100%. So yes, you will still need to get tested. If you've had the vaccine and you've developed signs or symptoms of COVID, then you'll want to get tested, and probably your organizations will still do surveillance testing, at least now. Down the line, that'll stop, but for now, yes.
Thank you. Yeah, I'll answer
Okay.
the next one in the next round. Okay.
I'm going to go through just very quickly how the vaccine works, just real quick, because I want to try to get. So the vaccine uses these little particles on the top. We take the information, the genetic information in the lab, and we're able to make something. It's not part of the virus. We make something, we put it in a little fat capsule, if you want to think about it, and then we inject that into you. There's nothing in here that is part of the vaccine. It's just basically instructions for your body. Your body now has the instructions, and what it does is your body will make some of these little kind of, we call them spikes. So this is just the same type of thing that the virus has. So this is what your body will see, and now it produces all the necessary protective antibodies. So if it ever encounters these things in real life, it can kill them. So that's how kind of the vaccine works. And it's different than it's different than other vaccines, which actually use parts of the virus. This does not. It simply takes this part of the virus. In the lab, we make the genetic information, we inject that into you, not the part of the virus, and then your body protects itself. So let me talk about now, when will the vaccine become available and how is it prioritized? Okay, so how is it going to get rolled out? So that is something that everybody kind of when can I get the vaccine? When can my individual? When can my parents? So there are different phases. Some of this is local, depends on the county you're in, but in a simple sense, direct support professionals in general are in the highest categories along with other healthcare providers to have priority to get the vaccine. That is because they recognize that what you guys do is, it's the same thing that I do. I mean, you're an essential worker, you're taking care of people, you're in the highest category to get it. There is some variation depending upon the county you're in, but basically you're a high priority group. So take advantage of that. There are literally millions of people clawing to get this vaccine. You guys really have an open door in within a certain way to get it. So I strongly encourage you to take advantage of that. The actual rollout of the vaccine is very, very complicated. I'm not going to spend a lot of time. Some of your leadership and administrators need to be familiar with this, but there's the federal, state, and local level. Many of the individuals that you serve, if you're a direct support professional in the group homes, will be getting their vaccine through a federal partnership. Um, federal partnership that will have CVS and Walgreens come in and give it to you. And that would be both for the direct support staff as well as the individuals. There are other ways for the direct support staff to get it at the local county level, depending upon each county slightly different. So it's a very complicated rollout, and a big undertaking. But and I'm just going to give you an example because there is variation in each county. In Montgomery County, there are 4 kind of ways you can get the vaccine. And remember, it's great to be in a high priority group, but it's only if you can get the shot that it makes a difference. So in Montgomery County, you can get it in hospitals, and that's mostly for like doctors and nurses. There are insurance companies where that'll be one mechanism, but the real kind of for our group, our population, sorry, let me go back. Hold on. For our population, the biggest places that people are going to get it are either through the clinics or through CVS and Walgreens. So that's important to be aware of. Okay, that's going to be the primary mechanism. Individuals will probably get it through CVS and Walgreens, and clinics will be used to supplement, and direct support staff may be getting it there. All right, let me take a couple of questions.
Okay. I think only one more came in.
Okay.
How can it really be deemed safe given that the fact it was produced so quickly? Aren't trials supposed to, or aren't, what am I saying? Oh, sorry. Aren't trials supposed to go on for several months to years?
So let me get to that because I think some of that I'll be answering here right in the next section. So when we talk about the vaccine, what most people want to know is, like in terms of should I get it? Is it safe? How well does it work? And what are the side effects? So is it safe? If we look who is rolling up their arm to get it, okay, it's not kind of people that don't know anything about the vaccine and don't have access to information. You have everybody from Dr. Fauci to Biden to Pelosi to the Speaker of that House to Pence. You got everybody that is involved in this is getting the vaccine if they can. Okay, so that's just one thing to keep in mind. That's obviously me being very happy to get it 2 days before Christmas. And you will get a card like this, which lists the date that you get it. So with respect to that question, it's not the speed with which something is developed that really is the primary thing. The question is, did it go through the necessary phases? And this vaccine went through the exact same FDA required phases. We have a phase one, a phase two, a phase three, which are very detailed, kind of planned out things. And over 90 to 100,000 individuals were studied. So it was done the same way that it is done with all the other vaccines. The difference is there were billions of dollars that were put into making this happen. So why was it able to be done so quickly? It's not because they skipped any steps. It's because they literally gave the pharmacy companies, the scientists, unlimited money to get it done. Okay. So, if I give you a car and an airplane and say, go to California, you're going to be able to get there in a few hours in the airplane. They gave them, I know people that personally work in the farm industry, on the vaccine stuff. They were working 20 hours a day. There was nothing they couldn't buy or get that they needed. So that's really the reason. The other thing is, in addition to just looking at the clinical trials, let's look at real life, okay? In Montgomery County, there have been right now, actually this number is doubled from when I made this up. There are over 150,000 doses of the vaccine given out, no problems, okay, at all. So it's not just in the clinical trials. In the United States, as a whole, over 5 million doses, no deaths, nothing that would raise concern that we have to stop giving it. So, I don't like to trust one thing, even me. I don't like to just trust the CDC or just trust the pharmacy, industry. What I like to do is look at everything. And whether you talk about the CDC, if you look at the drug company trials, if you look at what's happening to your neighbor in Maryland who got it, or if you look at the 5 million people in the United States, everything has pointed to the fact that it's reasonable to get. Um, the one kind of serious allergic reaction, which is real and people should know about, although it's rare, there are a small number of people, 11 in 1 million doses, where somebody can have a bad reaction. And that would be what we call an anaphylactic reaction. Probably many of you as DSPs, you probably have clients who kind of have peanut allergies or something like that. And some of you may be familiar with like an EpiPen. If somebody has a really bad allergic reaction, that's what we use. That's why they watch you. It's very rare, but if that happens, they'll basically use an EpiPen equivalent on you. And like I say, in the few people it's happened, they've all been fine. They're treated and that's it. So that's important to know. If you kind of think about the risk of like this allergic reaction, because a lot of people kind of focus on that. If we look at 1 million people, okay, and give them the vaccine, nobody is going to die from an anaphylactic or allergic reaction. If we take, 1 million DSPs who say, I'm not getting the vaccine, okay, 1,000 are going to die, not get sick, die. In Maryland, you have a 1 in 1,000 chance of dying from the COVID. And it's really important, many people see like their fellow DSP, or they know somebody who got it and they were okay. And that's true many times. I see the other end. I see the 40-year-old with two kids, the 50-year-old, who comes in and dies a miserable death, who hasn't been able to see a loved one since he came into the hospital, who leaves three kids behind. I bury those people every day. So this is a vicious virus, and it's not a pretty way to die. So, really don't just think because you know somebody who got it and they were fine that that's the way it's going to be. It's very unpredictable. Somebody gets it and they're totally fine. Somebody else gets it and that's lights out. That's it. In terms of the safety overall, again, over 5 million doses given, no deaths, nothing that would cause anybody to want to stop using the vaccine. In terms of efficacy, which means how well does it work, 95% for both the vaccines that are out there. Somebody asked this, I think, before, and excuse the typo, it should say shot number 2. Shot number 1, after 2 weeks, you're 50% protected. After 3 weeks, I'm sorry, after 4 weeks, you're 95%. So it takes roughly about a month after your first shot to get fully protected. This is kind of, again, about the safety. It's kind of a detailed scientific thing, which I'm not going to go into, but sometimes a picture's worth 1,000 words. If you look at people with the Pfizer vaccine who did not get the vaccine, they were in the group that did not get it. This is how many of them got sick and